Namaste everyone. So this is a video about what exactly it is that I teach. As I call yoga studios, they seem to ask or compare. What they do is they compare to yin, or they compare to ashtanga, or they compare to vinyasa or hatha, and it's very, very unique what it is that I teach. So if you can imagine, because there was one individual in particular that really zoomed in on the yin aspect. This is the yang of yin. So, just like in the yin-yang symbol, you have the dot of yin inside the yang and the dot of yang inside the yin. If you can imagine slowing down the practice really, really slow in a yin practice, and you find a place of really calm, just fullness in your body. From this place of super calm, isolate and engage a single muscle. For example, maybe serratus anterior under the rib cage there. You isolate a single muscle. That in itself is an achievement. Then you combine another muscle, say teres minor behind the armpit. Now, if you add to that posterior deltoid, the posterior bundle, this is an example of an armpit bandha. When you can isolate and engage in unison these three muscles, you have a very stable rotator cuff in chaturanga, which is the low push-up position, four-limbed staff, chaturanga dandasana. The same thing we do for the lower body too. What we do with the upper body is called the heart seal, and that product is available already. You go to ninthlimb.com, or you can see the promo video on this YouTube channel. The sacred psoas will be the next product. So it's the same concept of slowing down, isolating the psoas, iliacus, glute medius. And when you can do these, you get the groin bandha and you get the lower abdominal bandhas, which if that's not important to you, that's fine. If you're not the yogi, this is therapeutic. For the SI joint, the heart seal was therapeutic for the rotator cuff, and so many things, the neck. And it's physical therapy, but on a very slow and meditative and contemplative practice called Samyama, which is the combination of concentration, meditation, and absorption. And it comes in three parts as I teach it. The first part was the shoulder therapy. The second part's the spinal lower back and hip therapy. And the third part is the spotlight imagery. And the first two parts are needed. Those are divided simply because it's so much content. But that's one method. It's a reductionist approach. From there, we clarify datums on the body, like the first rib or the rim of the pelvis. And these are datums that are very useful to visualize certain. What you visualize is kind of up to you. What David Garrigues called them were spotlights. I think of them as halos. And there's 12 of them. David taught me 8 and I invented 4, and they've very much helped me in my practice because of the combination of extreme flexibility in my Ashtanga practice and the rigor, power, and stability of acrobatics practice and acro yoga practice, and the calm of pranayama, which is my favorite. And so that's Samyama. It would take me 5 hours to teach an individual one-on-one what was needed, and probably more like 7 or 8 hours if you wanted all of it, but not all of it is relevant to each individual. And for a workshop series, it takes 2 hours to teach each segment, because you go out, you come back, we get feedback, and there's many individuals. And well, no, it would only take 3 events. I would say 3 events. 1 for the heart seal, 1 for the sacred psoas, and 1 for the spotlight imagery. And ideally, you would implement some vinyasa in there. So maybe having a couple of classes of vinyasa would be very useful for that too, which is just a flowing, a breath synchronized flowing movement of a premeditated sequence of postures. And that's important. That's an important feature. If you're thinking of the postures as you're doing them, then there's a lot of phenomenon happening in the body and in the breath that we only have so many attention units. You have 100 attention units, and everything you think about is subdividing your attention units. And so we want to reduce it down to what Patanjali calls ekatattva, the single principle. And well, that's enough on that. I just wanted to talk about what Samyama is. The Sacred Psoas is a video product that will come out on November 15th that will be a compendium of these isolated activations around the lower back and the pelvis and the hips. And very good for sacroiliac pain, very good for sciatica, very good for back bending and hip rotation like the lotus posture. And there's unlike anything available in the world, to my knowledge. A lot of it comes from Bryce Delbridge, but I didn't learn the sequence from him, and how I put it together and the anatomy I was self-taught. The activations, a lot of them come from him, but he doesn't have video products. I do, so because I take the time to make those. And so stay tuned for that. This is the official announcement for that. And if you're interested in learning how to heal the shoulder girdle, how to heal the sacroiliac region, how to increase your range of motion in the hips, especially external rotation, and so on, you just contact me and we'll go from there. And this is that. Just wanted to talk about Samyama because it is a very central theme to my kind of yoga, what I do with myself. And what's very healing for me and how I approach it is continually evolving, because it's integral to what I do. The vinyasa is integral, the samyama is integral, the pranayama is integral, and then there's other subdivisions, meditation and whatever. But so hope this clarified something, and maybe even you learned something. If not, then I hope it was at least entertaining for you. Namaste.